I saw this post right here on Twitter, and it just, of course, stuck out to me like a sore thumb, just on the title alone, where it says just 5% of vaccinations have gone to Black Americans despite equity efforts. Basically, despite all efforts to try to sway Black people into taking the scene. It says a political analysis suggests disadvantaged communities are being bypassed, even in blue states fighting disparities. Now, I had posted on Twitter the other day that you are finding that there are seemingly a high amount of palm-colored people taking this scene, but these were some of the same ones who last year were trying to say, and some are still saying, that this thing is a hoax, they're overinflating the numbers and everything like that. But their numbers are extremely high for the scene. Now, could it be a combination? I mean, could it possibly be a racial disparity thing? Most definitely. Who knows which version of the scene they're actually getting? But also is a possibility, and I think this is the strongest one, that Black people just don't trust it. You know, they've tried everything. Like, think about it. When's the last time you seen, or any time you seen, a white celebrity be put out in the forefront advertising to take the scene? Meanwhile, you've had all walks of life from Black entertainers or athletes advertising for Black people or advocating for Black people to take the scene, or saying, oh, a Black woman helped develop the scene. Oh, it's being taken at this HBCU and a bunch of other things. But you never see the same thing coming from PC. Why? Because they aren't the intended target, but they just have to bite the bullet. Because see, 5% of Black people is not enough for them. They need way more than 5%. And Black people just aren't budging enough. And you know what is really going to boil down to? It's just going to boil down to they're going to continue to do more things to try to make Black people do it. Remember the last effort they tried, and I talked about it on my channel, was with the marijuana, with the weed in DC, saying, well, we're going to start giving out weed in DC, little bags of weed, if you come and take the scene. Who do you think they were talking to when they said that? But I'm going to go ahead and read this article and see what else they're talking about. Black and Latino Americans. See, like I told you, what did I tell you? They always like to lump Black and Latino people together when they see something that is wrong. Otherwise, it's just Black people. Are falling behind in the nationwide race to get vaccinated against the COVID-19, even in blue states and localities praised for championing racial equity during earlier phases of the pandemic. Red, blue, does it really matter? So far, the U.S. has racial and ethnic data for only about half of the scene doses given. Among those, just 5% have gone to Black Americans and only 11% were given to Latino recipients, according to the Centers for Disease Control and Prevention. A political analysis of the available data suggests the disadvantaged and undeserved communities are being bypassed, including in those states that have not yet publicly broken out data by race and ethnicity. Washington, D.C.'s hardest hit and predominantly Black neighborhoods have lagged behind wealthier wards, with vaccination rates between 7 to 9% among residents aged 65 and older, compared with 25% in the northwest part of the city, which is mainly, of course, palm-colored. For those of you who don't know, that's over there near where Georgetown is, something like over in that area. Let's just say it is a racial thing. If it really is a racial thing or racial disparity behind the whole thing and why Black people can't get can't get the scene, and if that's what they're trying, for the Black people that do want to get it, what are they going to do about it? Because it sounds to me like you're just basically practicing age-old Jim Crow, pre-Jim Crow tactics. That's probably another reason why Black people don't want to take it, because some of them don't want to go out of the way to try and get it. They got to go all the way across town for some of them just to get it, if they can even get it. And probably into a neighborhood that they've probably never been in or don't want to be at. Like they don't make it accessible locally. And I always keep saying to people, they need to find out what is inside that scene, because you can't tell me that some people aren't allergic to some of the ingredients that's in there, even if it's just one. In Michigan, Detroit is falling behind rural counties in the state's Upper Peninsula, despite policymakers' efforts to make the city a priority. Now, you know, Detroit being predominantly black, and they said versus rural areas. Like I said, they claim that black people were affected the most by COVID last year. They said it. They said it so many times, and they're still saying it now, even though I don't know how true that actually is, but whatever. They kept saying it over and over and over last year that black people were heavily affected by this, but the way that they're displaying this, they're trying to make it seem like black people either are not going out there to get it, they're not trying to get it, even though we're doing this and we're doing that, and there's still resistance against it. And then they're also now coming with the racial disparity thing, or the racial disadvantage thing. But like I said, the same group of people that yelled and cried and bitched and moaned and complained for months because they couldn't go outside, that COVID was fake and it was a hoax, are the same ones rushing out now to get the scene. So it makes you wonder who really is affected. Like, that means y'all thought it was y'all thought it was real the entire time. Because if it was a hoax, y'all wouldn't be running out there to get it. Now you gotta ask yourself a question. For those, the group of people who are affected by it the most, why are they getting less of it? And why are the people that claimed it was a hoax getting the most of it? See, they don't even ask that kind of question. I will, but I know they won't. Addressing these disparities while ramping up vaccine supply will be a crucial early test for Joe Biden's administration. He signed an executive order on his second day in office aimed at tackling racial equity and has named advisors to specifically focus on disparities in health, but solving the problem will require more than good intentions. This pandemic has really exposed the failures of our healthcare system, said Representative Raul Ruiz, a physician who represents a district with many Latino farm workers with limited health care. We cannot rely on this healthcare system to address equity. We are only going to continue to fail, and we see that now with the vaccine distribution. The federal government doesn't explicitly mandate vaccines be distributed or administered equitably. So you got states like Michigan that are well-meaning and thoughtful, but didn't have a comprehensive plan. Deborah Furr Holden, a public health expert at Michigan State University, who serves on the state's Virus Racial Disparities Task Force, said in an interview, "In the absence of a mandate, our natural drift is to inequity," she added. An early stumbling block has been a lack of data. In theory, the CDC requires states to report race and ethnicity data from the start, but the rule was not strictly enforced, and some states did not initially require providers to collect the information, leaving major gaps in efforts to identify unmet needs. So basically what they're saying is because they didn't mention race in their initial data, they didn't know exactly who to give these the scene out to, even though they kept screaming to the top of their lungs for the most part of last year, saying that black people were the ones mostly affected by it. I mean, but you know, and what's so crazy is when I was looking at the comment section under the person who posted this, they was like people saying good. As far as like having black people be a very low percentage of those going out there to get the scene. Now, we're not sitting here telling you to not go out there and get it. We're just saying be cautious, because we've heard the stories about what's happened to with the side effects of what happened with people who took it. Notice lately, people have stopped talking about the side effects, even if there are side effects that we had. And I think they started to stop after what happened to that doctor. You know, the one who got the second one and then he just passed away. Notice they really stopped talking about it. Or if it happens, they'll try to say that they had something else going on with them and whatnot. Let's see. Other states are collecting information but have declined to release it, citing similar quality issues. The CDC says 47% of vaccination data is missing information on race and ethnicity, a flaw public health experts say needs to be corrected as the pandemic enters a new dangerous phase. So they pretty much did it again with the CDC. We can't keep kicking the can. We can't keep saying we don't have the data. The data isn't great, said Cara James, former CMS director of the Office of Minority Health, who now leads the organization Grant Makers in Health. Marcella Nunes-Smith, chair of Biden's COVID-19 Equity Task Force, said at a Monday White House briefing that holes in the record don't just hurt our statistics, they hurt the community that are the highest risk and have been the hardest hit. Data in those states have collected, it revealed stark racial disparities, with white residents typically getting vaccinated at more than twice the rate of black residents. In Pennsylvania, which has one of the largest disparities, the ratio is more than 3 to 1. We have had such weak federal leadership up to this point. At this stage of the pandemic, it is appalling that there are not standardized reporting systems, said Jeffrey Levi, professor of health management and policy at George Washington University. And then they put a chart in here. Y'all can't see the chart, but they put a chart in here that says white Americans are being vaccinated faster than black Americans. Like I said, this is the same group of people that claimed that this thing was so fake and it was a hoax. On Thursday, Representative Ayanna Little Bill Hill Presley, and Senator Elizabeth Warren of Pocahontas, and Ed Markey, don't know who that is to give him a nickname, sent a letter to acting HHS Secretary Norris Cochran, urging the department to collect and release more comprehensive data on race and ethnicity. Public health experts say vaccine hesitancy is driving some of the racial gaps, referencing polls suggesting black Americans are more worried about getting the shots when the vaccines are still so new. Age is another factor. In the initial vaccine, I didn't even mean to say the whole thing. In the initial Cine rollouts of health workers, younger staff, who also tend to be more racially diverse, have been less likely to volunteer for shots. It is more the elderly wanting the Cine, and I can agree with that because I've seen more elderly people wanting to get in than younger. Explained Ine Amjad, I'm guessing that's how you pronounce her name, commissioner and state health officer for West Virginia's Bureau for Public Health. Younger people tend to see more disinformation about scenes online, she added. West Virginia has one of the nation's more successful scene rollouts. But some experts argue that focusing too much on hesitancy misses a larger point, that a lot more has to be done to get the scene into these hard-hit minority communities, at times in places where residents can access them. Scene hesitancy is a real concern, but I worry that focus on scene hesitancy is a way to deflect responsibility for equitable distribution on the front end, said Ann Sosin, director of the Dartmouth Center for Global Health Equity. Even in cities and states without comprehensive data, racial disparities can still be seen clearly on maps showing where doses have gone. In the District of Columbia, residents in predominantly black neighborhoods in the East have had the highest COVID-19 death rates, but are now receiving fewer doses of the Cine. If they know all these people are dying, quote unquote, so they say, and they aren't giving them the Cine, then you got to ask yourself this question: are they doing this because they don't have it, or they're doing this on purpose? I think it's a combination of both, but more leaning towards the latter. I think they're definitely giving it out to other communities, or another community in particular. Because when they keep mentioning those wards in DC, I keep thinking of Ward 8. And Ward 8 is one of the most neglected wards in DC by far. That's because it's the predominantly black ward. While the city did seek to open many vaccination sites in these neighborhoods, the online registration system let residents sign up for appointment slots regardless of where they lived. With the scenes in short supply, the slots were disproportionately taken by residents from other parts of the city on a first-come, first-served basis. Elderly residents in particular also struggled with the computer-based system, and phone lines set up as an alternative were quickly overwhelmed. We were inundated with calls and messages from constituents, and we observed it anecdotally ourselves after going to some of the sites to see visibly that the vaccine, there I said it again, oh well, distribution was overwhelmingly inequitable, favoring wealthier and white communities, said DC Council member Kenyon McDuffie. They travel from the wealthiest wards to the poorest wards in the city. That's something I didn't take into consideration. I did not take that into consideration. And that's actually a very good point. They came from the wealthiest parts of the city to travel to the poorest parts. Some places they probably never will go to. They might ride through it, if that, or they may take a detour to come down there to get it. And if they came in droves, then that left a lot of people who lived there out of the way. You know what it's kind of symbolic that they're coming down there to get a shot. And it reminds me of how during the crack era, if there was some white people that got caught up in that, and because the crack was mainly in these poor, impoverished areas, that they would come from the nice part of town to the poor and impoverished part of town to get their fix. And now look at what's happening here. It's almost like a cyclical thing. Experts also argue Cine hesitancy plays a larger role when residents have to compete for scarce slots. If they are unsure about the Cine safety, they aren't as motivated to keep trying to get an appointment. If you just say, we're giving the Cine to whoever's first in line, then it disadvantages people who have questions, said Joshua Sharfstein, a vice dean for public health practice and community engagement at Johns Hopkins University, who previously served as Maryland's top health official and as the deputy FDA commissioner during the Obama administration. DC has also worked with providers to distribute doses outside of central appointment system by having them directly arrange appointments with patients, but minority populations are less connected to health delivery system generally. But you know what it's also saying, just reading that there's still a lot of avenues and a lot of places that black people, and I'm just talking about us, like they say minorities, and I know what they're trying to do. They're trying to lump in the Latinos with us. They can talk about it from their angle. I'm going to talk about it from ours. Because black people have been shut out of so many institutions and still are. And what they're saying in this article proves that. The access or the limited access to a lot of different things. McDuffie successfully pushed the city to reserve a portion of the Cine supply for people who live in the hardest hit zip codes. He also secured more phone staffing for residents unable to use the online system. They must be prioritized, and you cannot wait for these people to come down to City Hall and ask, said McDuffie. Michigan won praise earlier in the pandemic for focus on equity, including creating a dedicated task force on virus racial disparities. But early signs show it too is facing inequities in the Cine rollout. Officials said they are working on fixing gaps in the data and hope to publicly release it within the coming week. But like other jurisdictions, a map of the region's vaccination efforts suggests disparities are emerging. Rural and predominantly white counties, especially along the state's Upper Peninsula, have led the pack with more than 10% of their population having already received the first dose. In Wayne County, which includes Detroit and where more than half of the state's black residents reside, just 6% have received the first dose. Like other states, Michigan officials expect the first round of direct demographic data to likewise show substantial disparities when it is finally released. In an interview, the state's chief medical executive, Johnny Caldoun, said the initial disparity was caused by the prioritization of health workers and also Cine hesitancy. For the next phase, Michigan is using the CDC's Social Vulnerability Index to determine where to allocate more doses, in addition to the number of elderly residents and essential workers. We are using an equity lens for how we are allocating doses across the state, explained Caldoun. The state health department is also working directly with the city of Detroit, allocating the city extra doses in addition to the formula-based allocations distributed across the state, and they're partnering with local providers for targeting access in communities of color using federally qualified health centers, mobile clinics, and community-based vaccinators. The best public health happens when you go into neighborhoods and when you're working with communities and when you're addressing people who don't have access to transportation and are homebound. The state has set an explicit goal for zero disparities in Cine distribution similar to its efforts on WUVIC cases and deaths, but there is no specific deadline, and Khaldun hopes to achieve the goal as soon as possible. Flint is predominantly an African American city. We already knew that based on how they treated the whole thing with the water situation. I recently got my first Cine dose in the city of Flint at an administration site, and I was the only black person receiving the Cine, said Furholden. And that's the end of the article. But listen to that. They were the only black person there in Flint to receive the vaccine in a place that is predominantly black. That goes back to the whole thing about in DC, where they said that wealthy white people would come from their area, which was mainly in Northwest, and come down to the poor areas, which is probably somewhere in Southeast or Ward 8, to come and get the vaccine. I bet that's the same thing there. So basically, that palm color is coming from their area to here. It's almost like gentrification. You know how they come from a particular part to move in. Now that the city's starting to develop, it kind of reminds me of that. So that's like an interesting take on it as well. But like I said, all in all, I think it boils down to some of the stuff that they said in here, but mostly because a lot of black people just don't trust it. They're just saying, here, go get it. And then they think dangling black celebrities and black figures in our face is going to make us just jump out of our chair and say, you know what? Today, I'm going to go and get the Cine because so-and-so said that I should. I mean, they have pulled out all the stops. I mean, between getting certain celebrities, public figures, the advertising, well, for DC mainly, of giving away free weed. It's crazy. It's crazy. But y'all let me know what y'all think about this down in the comments. Like, share, subscribe. If you haven't done so already, make sure that you text the number pinned down in the comments below so you can receive notifications every time I upload a new video.